Did you know that there's 2 million visits every year to doctors for patients that are complaining of shoulder pain? Maybe you have shoulder pain. Maybe you have weakness. Maybe you have trouble reaching behind your back or getting something off of the top shelf. If so, you might be one of those people that sustained a rotator cuff injury. And in today's video, I'm going to talk to you all about what the rotator cuff is, how injuries can occur, and what treatment options we may have that are just going to help both your pain and your function. So stay tuned. Hi, welcome back. I'm Adam Rosen, and if you haven't already, please like and subscribe so you're going to get updates every time a new video comes out. And in today's video, I'm going to talk to you all about the rotator cuff, and it's the rotator cuff, not rotary cuff. But the rotator cuff is an important stabilizer of our shoulder. Now, the shoulder is made up of 3 bones. There is the humerus, which is the arm bone, and it has a ball attached to the top. And then there's the scapula, and the scapula has a shallow socket where that ball interdigitates, which allows us full range of motion of the shoulder. And above that is the collarbone, or clavicle. Now, in addition to those 3 bones, we also have a large muscle that covers the outside of the shoulder called the deltoid. And there's also another tendon of the biceps, which comes up over the top of the shoulder and helps hold the shoulder in place. But the 4 tendons, which we're going to talk today about, are the rotator cuff. And these 4 tendons are the supraspinatus, which allows you to start bringing your arm up and out to the side. And then a series of rotators, the subscapularis, which is a tendon in front of the shoulder, which allows you to internally rotate the arm. And 2 tendons on the backside called the teres minor and the infraspinatus. And those allow you to externally rotate your arm. And when those tendons get damaged, torn, or they become inflamed, it can result in pain and dysfunction of your shoulder. So if you have pain and you have dysfunction of this rotator cuff, you might be wondering, how did it happen? How can you injure or damage the rotator cuff? Well, one of the most common reasons that the rotator cuff develops pain from partial tearing or complete tears is due to age. As we age, it is very common to get meniscus tears in your knee and degenerative discs in your back. It is also very common to get degeneration or microscopic tearing of these tendons in the shoulder, and that can lead to further problems. There are also some people that have certain jobs, or they might have certain hobbies in which they do a lot of overhead activity, and that can also cause injury or damage to the rotator cuff. Occasionally, there will be one sudden traumatic event, a sudden fall, or grabbing something extremely heavy and trying to lift it, where that sudden one episode can result in a traumatic rupture of one or more of these rotator cuff tendons. So maybe you're wondering, do you have a rotator cuff injury? You might be wondering what type of symptoms are common in people that have rotator cuff injuries. Well, the most common thing that we hear about is pain, especially pain with lifting. Even light objects, people have pain and difficulty. The other thing that they may notice is a dull ache. It's more of a constant or chronic ache. Even at night, they'll have this chronic ache in their shoulder. When they go to lift their arm up overhead, say to get something off of a shelf, they might hear what we describe as crepitations, or what you feel or hear as these Rice Krispies sort of snap, crackle, and popping in the shoulder. A lot of people also find it's hard to brush their hair, reaching the arm up in that position, or anytime they have to reach their arm behind their back, they find that those extremes of motion are difficult. Just a generalized weakness and limited range of motion. So those are all the common things that many patients who present with rotator cuff injuries will complain of. Okay, so you've made it to the doctor's office for your shoulder pain, and you're wondering what they're going to do to determine whether or not you have a rotator cuff tear. Well, like any visit, we're going to take a very detailed history and listen to what complaints you might be having, and then we're going to perform a physical examination. One of the more common tests we do is what's called a drop arm test, where the arm is brought out to the side, and due to pain, the arm either drops to the side, or with very gentle pressure, we can push the arm down. We'll also test the integrity of the strength of the rotator cuff muscles by testing how strong your muscles are to bring your arm out to the side, called abduction. or how strong the arm is when we test the ability of the arm to what's called internally rotate or externally rotate. And this tests the functions of those rotator cuff muscles. Now, beyond that, we might do other tests. So very commonly, we'll get an x-ray as a screening test to make sure that there's no fractures or that you don't have significant arthritis in the shoulder joint. Beyond that, sometimes special testing like an ultrasound or an MRI might be ordered, which allows us to more carefully look at the soft tissues and evaluate the integrity of not only the tendon, but the muscles that are attached to those tendons to see how healthy or diseased they might be. Okay, so now that you've been diagnosed with a rotator cuff tear, you might be wondering, what do I do? Well, the good news is 80% of the time, patients will respond to conservative care, meaning non-surgical treatment. So what do we do? For starters, there's usually a short period of rest to allow the shoulder and the inflammation to subside. And the other important thing is activity modification. If you're doing any particular activities that are aggravating the cuff, we want to make sure that you stop doing them or modify them. The next thing we would do is a course of anti-inflammatories. So an anti-inflammatory pill, either over the counter or prescription, or occasionally a cortisone injection. Beyond that, the other important and mainstay of non-surgical care is therapy. So you can either do a home exercise program, and I'll put a link in the show notes to a home exercise program that you can do to strengthen the shoulder. And the other thing is you might be referred to a formal physical therapist so they can work with you. Now, there are certain instances where surgery is indicated. So if a person has an acute traumatic rupture, lift something very heavy, there's a loud pop, the rotator cuff pulls off completely, we usually like to get in there sooner than later to repair that cuff tear. For other people, if they've failed a course of physical therapy, if they have persistent pain and weakness, and if the cuff is repairable, and that is determined usually based on the MRI, looking at both the integrity of the cuff and the muscle of the tendon to make sure that it is repairable, surgical repair might be indicated. So hopefully this answers questions that you might have about the rotator cuff, what it is, what are the symptoms that you have if you have a rotator cuff injury, and what treatments are available for you. And again, if you haven't already, please like and subscribe. And until next time, I'm Adam Rosen. Stay safe.